Hello, welcome. I'm Dr. Darren, family medicine physician, and today we're doing health education on topics that you want most. This video is on my top 5 causes of sore throat. Sore throat is one of the most common reasons to see a doctor, especially during these cold winter months. So this is a really important topic that you need to know about. We're going to be covering my top 5 causes of sore throat, including the symptoms, testing, and treatments. Now, if you like content like this, be sure to subscribe and leave a comment below letting me know what health topics you'd like covered in future videos. In addition, if you have any questions, leave them in the comments and I will answer all of them. Now, before we get started with sore throat, remember that these videos are for education purposes only. I cannot give personalized medical advice here. So if you're having symptoms such as a sore throat, make sure that you go to see your doctor right away. Now, let's get started with my top 5 causes of sore throat. Number 5, strep throat. Strep throat, or Streptococcus pharyngitis, is the most common bacterial infection of the throat. It can affect the back of the throat, the uvula, or the tonsils. The classic symptoms of strep throat include fevers, chills, a very sore throat, especially when you swallow, and swollen lymph nodes of the neck. Coughing is not a classic symptom of strep throat. A lot of cases of strep throat do not have a cough, and if there is a cough, it tends to be mild and not as bad as the sore throat. We have great testing for strep throat, and this consists of swabs that go in the back of the throat. We have a rapid strep test, which takes about 10 minutes to come back, and we also have a throat culture, which is more accurate, but that takes a day or two to come back. Because strep throat is an infection, it's important to stay hydrated, to get plenty of rest. Over-the-counter cold flu medicines can be useful, things like Mucinex or Dayquil, NyQuil, and pain medicine, such as Tylenol or NSAIDs, can be helpful. Because strep throat is a bacterial infection, it's also important to start antibiotics, such as penicillin or amoxicillin or azithromycin. Number 4, laryngitis. Laryngitis is inflammation of the larynx, including the voice box, where the vocal cords are located. Laryngitis can cause a sore throat. It can cause you to develop a hoarse voice, and it can also cause you to lose your voice completely. There are different things that can cause laryngitis, such as infections, irritation of the throat, and overuse of your voice, such as talking a lot, singing a lot, or shouting a lot. There is no specific testing for laryngitis, although infectious disease testing can be helpful to figure out the cause, such as testing for strep throat, or testing for COVID, or for influenza. The way that we treat laryngitis is to take care of your throat. You want to rest your throat, so do less talking and less singing, and certainly avoid shouting. Saltwater gargling is really helpful for this. And honey is also useful, just taking a few spoonfuls of honey and just letting it drip down your throat, and that can be soothing for the larynx. If the laryngitis is caused by an infection in your case, then treating that infection will also be important. Number 3, acid reflux. Acid reflux, also known as gastroesophageal reflux disease, or GERD, is one of the most common causes of sore throat. Acid reflux happens because there's too much acid in the stomach, and the valve connecting the stomach and the esophagus is more open than it should be, and this allows acid to move up the GI tract toward the mouth. People with acid reflux can get a variety of symptoms. They can get upper abdominal pain, chest pain, throat pain, irritation of the throat causing them to need to clear their throat often, coughing, and they could also get nausea. These symptoms tend to happen after eating a big meal, a spicy meal, a meal where there's alcohol, caffeine, soda, or after consuming NSAIDs like ibuprofen or naproxen. These symptoms tend to also come on when you lie down, especially if you lie down shortly after a meal. The treatment for acid reflux is to undergo lifestyle changes to prevent this. And this includes having less alcohol, less caffeine, less spicy foods, less carbonated beverages, avoid NSAIDs, and also avoid lying down shortly after eating. So a good rule of thumb if you suffer from acid reflux is whatever your bedtime is, don't eat or drink anything within 2 hours of going to bed. In addition, we have really good medicines to treat acid reflux, and this includes antacids like Tums, antihistamines like famotidine, and proton pump inhibitors like omeprazole and pantoprazole. Number 2, allergies. Allergies are extremely common, and they're also a common cause of sore throat. People with allergies have an immune system that is overly sensitive to harmless things in the environment, like plants or animals or mold or foods or other materials that are in the environment. The symptoms of allergies may include itchy rashes, sore throat, coughing, red eyes, runny nose, and nasal congestion. And in extreme cases, allergies can cause swelling of the face that may make it hard to breathe. Laboratory testing can be useful in diagnosing allergies. If you feel like you're suffering from allergies, I recommend that you use a journal to document your symptoms and try to keep track of what seems to be triggering your symptoms, whether it's certain plants or animals, when you go outside, or when you're eating certain foods. If you're able to generate a list of possible things that might be triggering your allergies, your doctor can order specific laboratory testing to see if you, in fact, suffer from those allergies. We have excellent treatments for allergies. Antihistamines, such as Claritin during the day or Benadryl at night, are very useful. In addition, Flonase is very effective. Flonase is a steroid spray that goes up the nose. If those treatments are not giving adequate relief, another option is to use prednisone pills. Prednisone is a strong anti-inflammatory medicine that gives relief from allergy symptoms. If you're ever having an allergic emergency in which you're having allergies that are causing swelling of your face and making it hard to breathe, use an EpiPen right away. And if you go to the hospital, they will administer epinephrine right away to help to treat this allergic emergency. And finally, my number one cause of sore throat, the common cold. Viral upper respiratory infections, including the common cold, are the most common causes of sore throat. A cold can cause a variety of symptoms, including sore throat, coughing, fevers, chills, and also other symptoms such as headaches and body aches. The most important treatments for the common cold are to drink lots of fluids, get plenty of rest, and use over-the-counter cold flu medicines such as Mucinex or Dayquil NyQuil to help to alleviate your symptoms. Because the common cold is a virus and not bacteria, antibiotics are not going to be helpful here. That's it for today. Those were my top 5 causes of sore throat. Thank you for watching. Be sure to subscribe and leave a comment below letting me know what topics you'd like covered in future episodes and if you have any questions. Remember that these videos are for education purposes only, so if you're having symptoms such as a sore throat, make sure that you go to see your doctor. Bye-bye.